Hi, my name is Elizabeth Evers, and I'm presenting on Pick's disease. I'm going to go over some quick facts, some evidence-based intervention and information. So, some application to this is from a TV show called Teen Wolf. Now, in the show, one of the main characters, mom, dies from frontotemporal dementia. Now, this is a flashback, and it's going to show the symptoms of paranoia and aggressive behavior. And I'll narrate some of it if you can't hear the sound or like the volume, because the volume's too low. So she says that she thinks he's trying to hurt her. So that shows the paranoia of it and the delusions. So there she said he thinks he's trying to kill her. She thinks he's trying to kill her. And then there's the aggressive behavior that you could see.
You killed her. And now you're killed.
So diagnosis and brief description. Pick's disease, or also called as frontotemporal dementia, is a type of dementia. It affects the frontal and temporal lobes, as you can see on the brain there and there. Those are the two lobes. When doctors look for Pick's disease, they consider the clinical hallmarks, which is atrophy in the frontal temporal lobes, as well as change in personality, behavior, and language. To diagnose, they use assessment tools like neurological imaging and cognitive testing, and the disease is progressive and terminal, meaning that there is no medication to slow down the progression or reverse the damage being caused. So the etiology. The disease is characterized by Pick's bodies, which are accumulations of tau. And often it's caused by a genetic mutation in the DNA. So to demonstrate this is going to be the brain. Okay, so tau proteins form together and clump together in these chains, and they create what's called Pick's bodies. So those Pick bodies attack the brain and cause the brain to atrophy. And what's kind of cool is you can see that, not maybe from back here, but you can kind of see that there's little holes in it. So you can see that can be representative of the atrophy that's being caused as more Pick's bodies are being added to it. All right. Pathophysiology. So it affects the frontal and temporal lobes. It excludes the parietal lobes, the occipital lobes, the cerebellum, and the brainstem. The amount of decline and in brain volume per year is about 4%. It causes a debilitating personality, very big change in personalities, and behavioral alterations, as well as impaired communications and interpersonal skills. You can see bilateral and unilateral atrophy. So atrophy can be either in both hemispheres or one hemisphere. Atrophy areas include the occipital frontal cortex, the anterior temporal lobes, the insula, the anterior cingulate cortex, the anterior insula stratum, the amygdala, the hypothalamus, and the thalamus. So in these pictures, you can see the cingulate gyrus is right here. You see the frontal lobes here, and you can't really see the temporal lobe because it's a sagittal cut. You have the frontal and temporal lobes, and so the anterior temporal lobe is the front part of the anterior lobe. This little front part right here. This picture shows the thalamus, the hypothalamus, and the amygdala. This one shows the insula of it. So when you pull back the gyrus, where this line is of the gyrus, when you pull those back, that's the insula that's affected. So in this picture, there's 3 different brains. You can see the neuroimaging of a normal brain and Alzheimer's brain, and you can see the difference in that, and a little less here and here. And then you have the Pick's brains, which you can see a lot in the front is decaying. You can see just the difference in shape as well and the color. And right here would be the insula right there that's decaying. This is another very sick brain, as you can see, with the deep holes in the gyrus in the frontal area right here. Prevalence. So Pick's disease is quite rare. It only accounts for 0.4 to 2% of all of dementia cases, and it is 3 to 5 times less common than Alzheimer's. So medical management of diagnosis, like I said earlier, there's no medications to treat the disease, so a lot of it is management of symptoms. Those medications being antidepressants, mood stabilizers, and neuropleptics, basically antipsychotics. Some other methods used for treatment are like therapy and intervention, some sort. The related populations that are affected, it affects usually young people comparatively to what other dementias affect quite older people. The onset is before the age of 65, and the disease duration is usually 6 to 8 years, so it progresses pretty fast. Some related disorders, dementia, of course, it's a form of dementia. It's a form of a frontotemporal disorder, so it's related to any kind of disorder that affects those frontal and temporal lobes. Alzheimer's disease, it's quite often misdiagnosed as Alzheimer's disease. There's a behavioral and language variant of it, and if there's a familial history of dementia, that tends to be a risk factor for Pick's. So condition-related precautions, they urge that you keep a permanent routine to prevent any problems with behavior. They encourage that for roaming issues of people wandering, that creating a safe place for them to go when they roam, since they often go to the same spots. Since verbal communication is very hard, nonverbal communication with that person is very important to communicate. Hyperality, which is overeating, is also very common. Carbohydrate loading, so it's important to watch the intake that they have. Hypersexuality is also another key behavioral issue to watch for. They often say that correcting and confronting, as well as redirection and distraction, often makes the problems worse when they're occurring. The study that I found says that you should remain calm and use positive nonverbal communication, as well as taking a step back from that situation physically and emotionally. As well as infections and multiple organ failure can be common issues that come with this disease to watch out for. So applicable medical treatment. Like I said, pharmacology-wise, it's a lot of just treating the medical symptoms. So SSRIs, which are selective serotonin reuptake inhibitors, and that's used for depression, inhibition, as well as the obsessive compulsive behaviors that come with it. Mood stabilizers can be used to control some of the behavioral disturbances that are caused, as well as antipsychotics are used with the delusions, hallucinations, and aggressive behaviors. Some non-pharmaceutical treatments include caregiver-based treatment, and which is educating and supporting the caregiver, and patient-based treatment. So behavior modifications, that the use of the ABC model, and what we're going to talk about next, which is TAC. So some treatment related to OT, they have found that tailored activities programs do a really good job at engaging a person with dementia in meaningful activity and actually increasing the amount of time they have till they really become to a point where they can't do much. So the program directly impacts the person with dementia and the caregiver. So it includes the activities for the person as well as education for the caregiver to implement those programs when the OT is not there. So it includes 8 home visits with 3 phases. Those phases are assessment, implementation, generalization, and closure. Assessment is usually gathering info about what that person likes, their cognitive testing, and ways that we can tailor those activities to them and create 3 of individualized activities. The implementation phase is educating that caregiver on how to interact with the person with dementia, how to help them do those, to give them skills for when those challenging behaviors come up during the engagement in activities. So, and then lastly, generalization and closure, which is applying those skills that they learned for those specific activities to other issues that come up besides in those activities. Some areas of occupation that is impacted, or areas in occupational performance that are impacted, are occupations, the ADLs, the IDLs, work there to the point where they can't work anymore. Leisure and social participation is impaired. Some client factors, you have the specific mental functions and global mental functions, as well as verbal and speech functions of the body functions as a whole. And body structures are also impaired. So performance skills impaired are processing skills, social interaction skills due to lack of verbal communication, performance patterns, roles, habits, rituals. Those roles are changing because they're not being able to work anymore. Habits and routines are changing due to the fact that they can't do all the same activities and they need more assistance. Environmental and context changes. So social, personal, cultural, temporal, and physical are all changing as well and impacting. These are my references. And that's it.